So let's proceed to color of the skin. So the skin is this is the thinnest layer of the integumentary, which is have the epidermis, subcutaneous, and dermis. These are the type of the skin. Next, we need to assess the color of the skin of our patient. But before that, we need to perform an hand hygiene for disinfectant and to prevent the spread of the microorganism. So the color of the skin of our patient is pinkish and very normal, as you can see. So, ma'am, is it okay to you? I'm Princess, your student nurse for today, and I'll be assessing your skin. Is it okay to you, ma'am, to assess this? Okay, thank you. So as you can see, the skin of our patient is very normal. The color is white and pinkish. It's very normal on contrast to other abnormalities. Is very colorish and dry. But for the client is a normal. It seems to me is very normal. So here, normal, skin here, okay, skin, it's very normal. So next, let's proceed to the texture, the surface. For the surface condition. For the surface condition, okay, may see your hand, your arms, okay, very normal. It downwards. In downwards is very smooth. Is it normal? This is normal. For the turgor, and for the turgor is this is a type of elasticity of the skin of the patient. So let's take a test if her hands is having an elasticity of how is it elasticity is. Okay, let's make a documentation for the color of the skin is normal, pinkish, and white. So the texture is normal. The trigger of the elasticity, let's check. Normal. Okay. Your elasticity of the trigger of your skin, ma'am, is normal. And for the texture is normal. And for the color is normal. So next, let's proceed to the scaling. For the scale of the skin is smooth, not dry, but it is somewhere some areas are dry, but here are smooth and smooth here. Mostly the majority here is smooth, which means that the client's skin is smooth and doesn't have any condition. Ma'am, may I ask you if you have an allergy or you have some cases the past history of having a chicken pox or other problem?
Yeah, I have.
What's that, ma'am?
Chicken pox and I have allergy.
Okay. Okay, thank you for answering my question. For next is the the scaling is smooth, so it is normal. Even if it is dry, it is normal because skin needs water to absorb and make it grow the hair inside. You know, hair distribution. Let's see if the hair of her skin is normal. So if there's bald or any problem, so here, and other skin here. So is normal. So next we need to have a documentation for distribution is normal, and hair characteristics it is normal also. For the investigation, it is smooth, and also have some cases that the skin is having a um of some cases are the people who have a tattoo so that their skin is having complication and irritation, and it is very painful. But for me, for the prevention and for the awareness of us, much better if we don't have a tattoo to make your skin normal and brighter. So next, let's proceed to stomach. This is not applicable to our patient because this some cases are from have and some cases are having a disease here in stomach. So we have a stomach, mom. Okay. Next, let's proceed. So I have a comments or a comment here is normal and the client is very attainable. For for the next assessment, we need to assess the fingernails and toenails. The color, share cleanliness and good if it is a problem or have not a problem. So then irregularities in surface, if it is normal, if have a spaces or other lymphoma, I think it has lymphoma or a disease that have a here in the toenail, inside the toenail have a blood lymphoma, I think, and inflammation around nails. If it is a have lesions or other problems, and fungal problem, yes, this is commonly problem to us in the toenails and other part of skin, as you know. The fingernails also have a fungal problem. Okay, so ma'am, I princess, I'll be your student nurse. Is it okay to assess your fingernails and toenails?
Yes.
Okay. For for that, we need to before that we need to perform the hand hygiene for the prevent from spreading of the microorganism. The fingernails, the color of the fingernails are pinkish, and is it normal? This is normal. I can see that here in the Nola is white, then pink. Okay, here in the left side, okay, it's normal. The color is pink, and the cleanness is good. For the colors in surface, in the also in the color of the toenails is normal. For the colors in surface, good. Inflammation on nails, good. For the toenails, fungal problem. Do you have a fungal problem, ma'am? Okay. Next, let's proceed to head and neck. The head and neck is a part of the body that it is important to assess as a student nurse because we need to assess that for us to know what the problem and what the proper prescribe or medication to give to our client so that the client is happy if you are the one who assess and taking care of them of her. Sorry. For the head motion describe. Asymmetric head position describe also. And for the shrugged shoulders, peritoneal edema, and unable to support head midline in erect, lymph node enlargement, dull puffy, yellowish skin, yellow skin, thyroid enlargement, or gill displacement. So for the asymmetric, make sure that the patient is to assess the head asymmetrically, as is okay. This is a normal. Then for the shrug and shoulders also and down. Okay. And for the is it and okay, the symmetric is okay. It describes that the head of our client is symmetric head position, shrug shoulders, peritoneal edema, unable to support head midline, alright, lymph attachment. Here, dull puffy yellow skin. No. Tracheal displacement. And next, let's proceed to nose and sinuses. Are you okay, ma'am?
Yes.
What do you feel right now? Or feeling right now? Can you please louder? You're fine. Okay, next proceed to nose and sinuses. We have a nose that have a nasal drainage. If it is her nose, you need to assess if her nose is have a nasal drainage or alternasal mucosa. And describe obsessive frontal sinus below. And also for the inflamed tender polyps lesions, edema, right nostril occluded, left nostril occluded. Now sinuses. For assessing the nose and sinuses, we need to have our equipment, which is the pen light. Here is the pen light used to see what's inside, if it is have a problem or not. If you have a bleeding or have a fungal infections or other bacteria here inside that we need to assess. Okay, ma'am, can you please your head upward slowly, and I want to check here. Said is it comfortable to you, ma'am? Okay, wait. Before that performing, we need to have your hand gloves, your working gloves, or either your sterile gloves. Sterile gloves to use to cover and to avoid the spreading of the microorganism. I have here sterile gloves. Okay, make sure you do not touch the enter the needle. Open. Okay. Okay. After performing a hand hygiene or hand washing, make sure you wear your sterile gloves or working gloves for assessing the nose and sinuses here. Okay. for awareness of harmful microorganism. So here it is, our pen light. Pen light is to use to see inside part of the side of the nose to know if it is have a problem or a condition here or not. So after that, we need to have the documentation and tell us to our client um, what the result. Ma'am, I'm your student nurse for today, and I'm Princess, and I want your preparation. Is it okay, ma'am, to upward your head and may see your nose here inside? What's in here inside? Okay, ma'am, is it okay? Okay, thank you. Make sure that you see what's inside. Okay. Okay, thank you, ma'am. As a result, and the conclude and the diagnosis for this, our client, the nose and sinuses is very normal. Have a a hairy like structure inside, and the nose drainage is okay. The outer nasal mucosa is okay. I described that I described that the outer nasal mucosa is normal. The absence of frontal sinus glow is okay. The inflamed tender, this tender of the skin is okay. Encephalitis lashes, no, have the kind of edema. And right nostril left nostril is excluded. Okay. The right here is okay. Next, let's proceed to our mouth and pharynx. So before that, it's okay to use these gloves while assessing the mouth and pharynx. So for the mouth and pharynx, this part is the mouth, the pharynx, then after the oral mucosa. So the altered oral mucosa membrane, make sure you have your tongue depressor to allow the what's inside the mouth to open and to state what's inside. Also, we need to use our pen light to see what's inside. Okay, ma'am, I'm the nurse, and I'll be assessing your mouth and pharynx. May you see, ma'am, your what's inside your mouth and your there and pharynx? Is it okay? Okay. Okay, ma'am. Okay. As I described the outer mucosa membrane. After performing all the assessment of the nursing, if you have any concerns, ma'am, and questions, clarifications, may you know, don't hesitate to ask questions to me, ma'am. And before that, we need to have our proper performing an hygiene to prevent and avoid spreading of microorganisms in our body. So after that, we need to summary all the we need to summary the assessment that we are already good, that we are already taking the assessment. So ma'am, as you notice as you all know that the assessing of the nursing interview gen ed and the other important that I taking to you is more valuable, and thank you for your cooperation, and thank you for your answering my questions, and I hope next time you need to have your proper hygiene for your for health awareness, and don't be stressed and need to have a rest for the rest of the days if you have you have a free time also, and eat vegetables and fruits for us to have you have a healthy lifestyle. And don't forget to pray, ma'am. Okay, that's all. Thank you, ma'am, for this day. I hope you enjoy our nursing assessment.
Yes, thank you.
Okay, for the for the thorax and lungs, we need to assess this to inspect the posterior thorax, the anterior, and the lateral thorax. So, ma'am, I'm Princess. I'm going to be your student nurse. Can you please cooperate for this assessment? Can you please stand up, ma'am? Yes. Okay. So, we need to check the client's posture. Sit down. Posture. Okay. Here. Okay. Here. Left. On the right. Left. So after we see what's inside the altered or mucous membrane, they describe that there's a pink color and it is very normal here in his throat, and her mouth is also normally formed, and this is very normal. The inflation inside is have a pinkish color, and it is and have bubble here in the throat up to parents. The hoarseness also, the lips dry crack. Want to see that the bruised grants teeth, also the lip juices, fissures, tongue dry crack. So you need to check that. Also the lips bleeding. This is usually cases which is have a dry lips or have a cracked lips. Tongue fissures also, the decay halitosis if the client have a bad breath. Let's check that on that. Then the gums inflamed, this have a problem in gums. Also the tongue bleeds if the tongue have a condition, have a bleeding or having inflation or other condition. Excessive salivation, is it the client is the senses of smell or the senses of taste is okay. Gum reduction also. So need to check the client's lips. Okay. The lips of the client is normal. So let's proceed to tongue dry decay halitosis. Can you please open? Okay. Thank you, ma'am. Thank you, ma'am, for coordination. Thank you. So, ma'am, the result for your mouth and parents is normal, and make sure you need to brush your teeth every day, 3 times a day, to make sure you're. So after we see what's inside the altered or mucous membrane, they describe that there's a pink color, and it is very normal here in his throat, and her mouth is also normally formed, and this is very normal. The inflation inside is have a pinkish color, and it is and have bubble here in the throat appearance. The hoarseness also, the lips dry crack. Want to see that the bruised teeth, also the lip juices, fissures, tongue dry crack. So you need to check that. Also the lips bleeding. This is usually cases which is have a dry lips or have a cracked lips. Tongue fissures also, the decay halitosis if the client have a bad breath. Let's check that on that. Then the gums inflamed, if this have a problem in gums. Also the tongue bleeds, if the tongue have a condition, have a bleeding or having inflation or other condition. Excessive salivation, is it the client is the senses of smell or the senses of taste is okay. Gum reduction also. So need to check the client's lips. Okay. The lips of the client is normal. So let's proceed to tongue dry decay halitosis. Can you please open? Okay. Thank you, ma'am. Thank you, ma'am, for coordination. Thank you. So, ma'am, the result for your mouth and parents is normal, and make sure you need to brush your teeth every day, 3 times a day, to make sure you're okay. For the thorax and lungs, we need to assess this to inspect the posterior thorax, the anterior, and the lateral thorax. So, ma'am, I'm consistent of your resident nurse, and please cooperate for this assessment. And please stand up, ma'am. Yes. Okay. So we need to check the client's posture. Sit down. Posture. Okay. Here. Okay. Here. On the right. Stand up. So after we see what's inside the altered or mucous membrane, they describe that there's a pink color, and it is very normal here in his throat, and her mouth is also normally formed, and this is kind of normal. The inflation inside is have a pinkish color, and it is and have bubble here in the throat up to parents. The hoarseness also, the lips dry crack. Want to see that the bruised teeth, also the lip juices, fissures, tongue dry crack. So you need to check that. Also the lips bleeding. This is usually cases which is have a dry lips or have a cracked lips. Tongue fissures also, the decay halitosis if the client have a bad breath. Let's check that on that. Then the gums inflamed, if this have a problem in gums. Also the tongue bleeds, if the tongue have a condition, have a bleeding or having inflation or other condition. Excessive salivation, is it the client is the senses of smell or the senses of taste is okay. Gum reduction also. So need to check the client's lips. Okay. The lips of the client is normal. So let's proceed to tongue dry dehalitosis. Tongue, can you please open? Okay. Thank you, ma'am. Thank you, ma'am, for coordination. Thank you. So, ma'am, the result for your mouth and parents is normal, and make sure you need to brush your teeth every day, 3 times a day, to make sure your